Hi, everyone. Welcome. Thank you for joining us today. We're very thrilled to kick off the three-part series with Alzheimer's Los Angeles. They're one of our incredible community partners. And Adriana Walcher will be leading the first of the seminars today. The next one will be on the 21st. Yeah, May 21st and then June 18th, I believe. So if you're interested in signing up for those, please come see us after. We can put you on the list. For those of you who are new to Lisa's Care Connection, we are a nonprofit that provides free programs and services to families and caregivers who are navigating the complexities of dementia and Alzheimer's. We have a lot of wonderful programs, including our partnership with Joslin Center here. If you're interested or have any questions, that green table at the back, come find us afterwards. Without further ado, I'll send it over to Adriana. Thank you, Adriana.
Okay, thank you so much, Bree, and hi, welcome everybody. Thank you so much for being here. Wow, what a great turnout. I'm really happy that you all are here today. So we're going to be talking about behaviors and Alzheimer's disease. So who here is caring or has cared for someone with Alzheimer's or another dementia? So pretty much everybody. Or maybe you have known somebody, right, with Alzheimer's or dementia that was on a family. Today's topic is gonna deal with how do we address these behaviors and how do we kind of understand what these behaviors mean and what could be causing them. So we'll start a little bit with some basics and then we'll watch a couple of videos and kind of work through dissecting the video and how we can communicate better and understand this behavior. First off, let's just take a moment, because as caregivers, you may not have time to just take a moment and take a breath. So let's just start off with inhaling and exhaling. Okay, sometimes you just kind of forget to breathe. And I do also want to acknowledge everyone online as well. So thank you for joining us online. Haven't forgotten about you guys. Okay. So who can tell me what is dementia, or who is familiar with dementia and Alzheimer's disease and what the differences might be? Does anyone have any idea? Yes, it is memory loss. Yes, dementia is when someone is experiencing memory loss. How does that differ from Alzheimer's disease, dementia and Alzheimer's? So actually you had that backwards, but very close. So Alzheimer's disease is a type of dementia. So first is dementia, right? So dementia is when there is some serious cognitive decline and it's causing some really serious memory issues where it's really interfering with that person's everyday life. And then an individual may go to the doctor to see, okay, what is causing this dementia? Maybe it's caused by something that can be treated, right? Maybe it's a side effect to medication. Maybe it's stress-induced, or maybe it is being caused by a disease. And Alzheimer's disease is a type of dementia. There are different types of dementias. Alzheimer's is the most common. There's vascular dementia, there's Lewy body dementia, frontal temporal dementia. So there are different types. So I do want to show just a short video that does show and talk about Alzheimer's disease and an overview of what happens and how it affects the brain. And I apologize, I did not, let's check, see if there's sound. Okay, where do we have the sound coming from? How do I move this bar? Oh, it's coming through the laptop.
The ability to even carry out
I don't know if they're going to hear it through the laptop.
An estimated 6.7 million Americans aged 65 and older.
Can you hear that?
Very little.
Okay. Oh, okay, we can crank it up a little bit more. And then, apologies, I didn't think about the video when I first got here.
Okay, I feel like this is gonna be really loud.
Oh, on the TV? Okay. Oh, yes. Oh, where are we going? Oh. Oh, so if it's going through the TV, they might not hear it on the...
What is Alzheimer's disease? Alzheimer's is a progressive brain disease that slowly destroys memory and thinking skills, and eventually the ability to even carry out everyday tasks. An estimated 6.7 million Americans aged 65 and older are living with Alzheimer's dementia today. Although treatment can help manage symptoms, and for some people, potentially slow it down, there is no cure. But every day, researchers are working hard to develop treatments that will do more than what's available today. Alzheimer's disease develops gradually, and its onset may not be obvious at first. But the damage to the brain begins years before symptoms occur. Let's explore what happens in the brain of a person with Alzheimer's. Two abnormal protein fragments, called beta amyloid and tau, begin accumulating in the brain, which damage and eventually kill brain cells. These proteins are commonly referred to as plaques and tangles. They start here in the hippocampus, the part of the brain where memories are first formed. As the disease progresses, the plaques and tangles slowly destroy the hippocampus, and it becomes harder for a person with Alzheimer's to form new memories. Simple recollections from a few hours or days ago are just not there. Over time, more plaques and tangles spread into different regions of the brain, killing cells and compromising cognitive and physical abilities. The damage caused by the spreading of the disease results in different symptoms. We use these symptoms to define the different stages of the disease. Eventually, the damage spreads here to this region of the brain, the temporal lobe, where language is processed. When that happens, it gets harder to find the right words or follow a conversation. Next, as the disease progresses, it affects the front of the brain where logical thinking takes place, making it difficult to plan, problem solve, and make decisions. Slowly, it moves to the part of the brain where emotions are formed. When this happens, the person with Alzheimer's gradually loses control over their moods and feelings, and their personality can change. In the later stages, the disease moves on to the areas of the brain that make sense of the world around us, including what we see, hear, and smell. In this stage, Alzheimer's can affect a person's senses and can even cause hallucinations. Eventually, the plaques and tangles cause significant damage throughout the brain as they spread and erase a person's oldest and most precious memories. Finally, the disease impacts a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates the lungs and breathing. And then, eventually, it also affects the heart's ability to function. The progression from mild forgetting to death is slow and takes place over time, an average of about 8 to 10 years. Although there's currently no cure for Alzheimer's, there is reason to hope. There are many promising developments on the horizon as breakthrough drugs and treatments are tested and become available. Meanwhile, information, programs, services, and resources are available for families, caregivers, and people living with Alzheimer's. Contact Alzheimer's Los Angeles at 844-435-7259 or our website at www.alzheimersla.org for more information. Until there's a cure, we'll provide the care.
What do you all think of the video? And did you hear, was it able to hear it okay in the back? Oh my goodness. Okay. We don't have a speaker, or does the adult center have a speaker we can borrow? Okay, because there's more videos. Sorry, they should be on our YouTube. Yeah. Yes, they should be this one should be on our YouTube.
It's supposed to be going to the TV, but it's not for some reason.
Yeah.
So,
Okay. It's okay, we'll see if she finds one.
let me do one more thing.
Okay.
Okay. Do you want to,
Just test it.
yeah, we could also maybe replay it if it works this time.
I don't know if I have time. It's a long video.
What is Alzheimer's disease?
Okay, so
Okay,
for
there we
the,
go.
yes, so sorry, we can't, just for time purposes, but there's other videos that are like very relevant to the course specifically. So, okay, apologies for that video. Okay. But any reactions to the video for those who could hear well? Sorry. Yes. Sure.
What's the difference when like someone starts seeing stuff?
When someone's seeing something, so having hallucinations. So that is a symptom of the of Alzheimer's disease, having some hallucinations.
Or when they start like leaving the house,
The wandering, yes, absolutely.
and they start knocking like at 3, 4 in the morning, or they start calling, and they grab the time.
Yes, those are all symptoms of the disease, absolutely. So what we think are unusual and bizarre behaviors are actually very typical of somebody with Alzheimer's disease. So, yes?
I thought the video was really powerful, the way showing how it spreads through the brain and then into the body. I've never seen that laid out that way. I thought that was really helpful.
Yes, because you can see how it progresses in the brain and the different areas it progresses and how ultimately it does get to the brain stem, which does regulate breathing and the heart. Yeah. So as you can see in this slide here that, a lot of behaviors can be a bit challenging because we do see that they can see or hear things. We were talking about the hallucinations. They can be very repetitive because of the short-term memory loss. They're very confused, right? Because this disease does just cause very general confusion, and that is a reality for somebody with Alzheimer's, that they are just constantly living in confusion. They may not trust others or become very paranoid. Yes, ma'am?
So back to saying, if we had an MRI, you would show what stage of dementia you were in by the way your brain looks.
Not necessarily. Oh, did I hear something? Oh, was that my voice? Through the, okay, that confused me, okay. So not necessarily, it can show how it's spreading, because you can see now with scans like the spread, like the plaques and tangles specifically, but, really it's kind of like their behavior kind of really shows like how they're declining and the symptoms that they're experiencing, and their abilities, like, their skills start to decline. So it's really more specific to, basic skills and how their thinking starts to change. Yeah, so that's really more what's telling you what stage they might be in.
What you had said on my mother's scan, the doctor was able to see the gray matter. He should specify.
Yeah,
He showed in the MRI, gray matter, that's where the dementia was beginning to form. So there is something, just like what you saw on the screen, that's exactly what he was able to see.
So it's a combination of like the scan and obviously the symptoms they're exhibiting is, can help determine the stage. So just continuing the list here, so they can get lost, so that's where the wandering takes place. They can become combative, they worry a lot, they could have sleep problems or get confused with day and night and refuse to take pills. So we will touch on today on medication as well as hallucinations and how we can respond to those specific behaviors. So when a person with Alzheimer's is exhibiting a certain behavior that we may deem as a challenging or difficult behavior, they're not doing it on purpose, right? Behavior all has meaning, and it's their way of communicating. So that's why we want to see, okay, what is this behavior mean to the individual, right? Are they sad, angry, fearful? Maybe they're uncomfortable or feeling pain. Maybe they're just sick, not feeling well, or they're frustrated because they can't do something, or they're just bored and they want a change of environment. So this class hopefully is going to help you kind of figure out what the behavior is trying to say. So as mentioned, right, they're not done on purpose, they're not done to annoy us or due to poor listening, right? So because they don't have control over those behaviors anymore, because the disease is, taking over their brain essentially. So they cannot think rationally or logically. So it's important to take that into consideration when you're trying to respond or communicate to them. But be aware that any huge sudden changes in behavior, like major changes in memory or mood, especially let's say after a fall and they hit their head, or more confusion, more yelling, anger, hitting, suddenly wetting the bed, fever or seizures, any big sudden changes, speak to your doctor immediately to see, okay, what's going on? Maybe there's something more there or something that needs medical attention. So as we move into the behavior part, we're going to use IDEA, which is a 3-step approach. So IDEA is an intervention that we like to use for managing and trying to understand behaviors. So it's a 3-step. So step 1 is ID, for identify the behavior. So you want to be specific of what is the behavior that you're observing. Step 2, E, for explore. So that's where you want to understand the meaning behind the behavior, what is causing it, and there could be different types of triggers that could cause behaviors. So it could be potentially a health trigger, like maybe they're sick, they're not feeling well. Perhaps it's an environmental trigger, right? Something in the environment, whether it's too noisy for them, maybe they're feeling hot, or maybe it's too dark and they can't see too well. Maybe it's an activity trigger. So activity trigger is maybe that the task that they're doing is too difficult for them, so they're being very getting frustrated. Or perhaps a communication trigger. So communication trigger would just be that they're not able to form the words to express themselves. So because of that, it's causing maybe them to become frustrated or agitated. And then step 3A, adjust. So that's where you want to adjust your approach, because as a caregiver, you are the one that needs to make those changes, which can be difficult, but it's important to recognize that those with Alzheimer's or any type of dementia, they can't change their way of thinking, right? They can't rationalize or think logically or understand why things are happening or why they can't do something, right? So because it's just part of the disease. So that is why, we need to make those changes and adjust how we're gonna communicate, adjust how we're gonna respond to those behaviors. So step 1 for identifying the behavior, you really want to describe what it is, right? Are they pacing down the hallway? Are they, not wanting to sit down in a chair? Do they keep wanting to leave the house, right? What is that specific behavior? And do others see it the same way? Is it bothering them, or is it bothering you, right? Really be specific of what that behavior might be. Step 2, explore why the behavior is occurring. So again, what does that mean to the individual? What are they trying to say or do? So really trying to understand the cause and interpret what they're trying to communicate to you. Step 3, adjust. So again, you will be the one who needs to change. So your attitude and the way that you speak and communicate can really influence their behavior. Because if you're maintaining calm and speaking slowly, then that's gonna, that it's gonna feed off on them as well. So then they're gonna hopefully also try to be calm and not get as agitated or frustrated. And you can be the one to adjust the environment, right? So if, you can make it a well-lit room, turn on the lights if it's too dark for them, or if it's too noisy, right? You turn off the TV or the music, etc. So now we're gonna put this idea strategy to work. And so we're gonna first start with hallucinations and watch a video about hallucinations. So as you're watching the video, I want you to think about what you see happening. So that's where you identify the behavior, what may be causing the behavior, and what the behavior means to the individual. So explore the cause, or explore the meaning, and how would you respond? So adjust. How would you adjust your approach if you were in this situation? So first, we're going to look at what maybe a common response might be.
I've noticed been waking up in the middle of the night and seeing things in a room that aren't actually there.
Wait, why is it frozen?
I've noticed been waking up in the middle of the night. I've noticed been waking up in the middle of the night and seeing things in a room that aren't actually there. We're both exhausted during the day because we're not getting enough sleep at night.
Well,
Is it a YouTube link or is it embedded in the?
it usually just always plays in the video because it is embedded in. I remember. But you can find it on YouTube.
Is the,
Yeah.
so,
I'm so sorry, everyone. I totally forgot to test the videos. I recently came back from maternity leave, and this is my first in-person class since coming back from like almost 5 months. So I'm a little off my game.
That is always tough.
Yeah.
Unfortunately, we're not patient folks.
Thank you.
You can always skip through those parts and then we can email folks the videos afterwards to watch out on our time.
Okay, are you able to access YouTube?
yeah, we can.
Because the videos are kind of the whole point of things. Okay. Where's the sound?
Something is happening because now it's not showing up on the TV either.
I used to take care of elderly and just recently passed away, but we started seeing things like there's animals or water on the floor, and it's over.
I think we're having connection problems because it's,
You're having connection problems here with Zoom because some of the people are online and Zoom is giving an error message. So I think Zoom is malfunctioning.
okay,
This looks like it's not.
yeah, yeah, okay. It's not you, it's the, okay, it is not you.
Maybe it's the internet.
Seems like it, yeah.
Okay.
I think just with the bad weather.
Sound working on the video?
Looks like it. No, I'm just trying to. Well, if it will share. Okay, it's not sharing on Zoom, but we'll just.
Like the,
I did, but
it's not sharing.
it just keeps,
Oh,
Like it's
it's not
not.
changing the screen.
not at all. So, okay, we'll just present.
Okay. This
Here?
video, that sound, can you play?
Yeah.
Okay. This should be the right
I'm
video.
gonna stand here because I'm gonna switch it back to the, yeah.
Yeah.
I'm just waking up in the middle of the night and seeing.
Take off those.
That aren't actually there. We're both exhausted during the day because we're not getting enough sleep.
Oops. I've never had that issue.
Can I?
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Mom, please. There's nobody here. No one's here. Go back to bed. Come on. Look, there's nobody here, all right? Go back to bed. Got a big day tomorrow. Come on. Good night, Mom.
A person with dementia may experience hallucinations when the disease affects the regions of the brain.
Okay, this is to watch after we discuss. Okay, so, sorry, in the presentation, it's, the video is clipped, so I'm pausing it here. Yeah. All right, so let's dissect this video. So what do you see happening? Let's identify the behavior. Yes, she sees something, she's hallucinating. So what might be causing the behavior and what might it mean to the person? In this case, right, the mother.
The shadow is possible behavior.
Yes, the shadow.
Misinterpreted as someone being.
Yes, she's misinterpreting the shadow as someone being there. Yes, so how would you respond? So do you think that the daughter responded in an appropriate way?
No.
No. What might be a better response if you were in that case?
Ask her what exactly what is she saying?
Sure, maybe, what are you seeing?
And see what they're, get an idea of what they're saying.
Yeah.
It has to put back.
Yes, trying to see what they're seeing, to have compassion. You had a hand over here?
Pretty much follow their lead, in other words, what they're exhibiting. Like, if I see a man, I would probably go in and say, oh, let me check with you, let's go see. In
Yeah.
other words, dismissing. Instead of dismissing, following the lead of the person that's there.
Yeah, so instead of dismissing her, acknowledging it and going, okay, let's see what's going on. Yeah,
Saying, where is the man?
yeah, where's the
So
man?
she comes to where the man is, and the daughter sees that it's that
The-
hat rack.
yes.
in the situation, maybe remove the hat rack.
Yeah, maybe removing the hat rack, which was the trigger for the shadow. Yeah, yeah. Okay, so absolutely, all really great suggestions. So as we see, right? Mother thinking there's a man in her room. So we see that they exploring the behavior, right? She's been misinterpreting the shadow. And, she is afraid in that moment. She's fearful. So, she does probably need some comfort, reassurance that she's safe. And so adjust, right? You can see this is how you adjust your approach, right? What can you do to help the situation? Well, as we mentioned, you can remove the coat rack that's causing the shadow or offer comfort, right? Listen, acknowledge her fears. It's very important that you validate their feelings because what they're feeling in that moment is real to them. Even though we might think like it's ridiculous or what do you mean? Why are you scared of a coat rack, right? But to them, it's very real. So you want to validate and say, I can see you're really scared right now. I'm here. Everything's okay. You're safe with me, right? Just offer a lot of comfort and positive words and affirmation. So let's see. I think this is it. Okay. So let's see what other suggestions can be done. So, okay.
That are responsible for interpreting sights and sounds. Hallucinations commonly involve seeing or hearing things that aren't there. They can transform ordinary, everyday experiences into frightening episodes. A good approach to reducing hallucinations is to identify and eliminate the objects or things that trigger them.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Oh, really? Well, let me take care of it. Okay. Oh, I see. Okay, come on. Come on, I'll take care of it. You stay out here. Now he's gone, okay? I'll sit with you until you go to sleep, okay? Mom, I think we should keep your coat rack outside so you have a place to keep your jackets when you come in.
Oh, okay, dear.
Okay? Okay, good night.
Remember, patients experiencing hallucinations are having a difficult time interpreting their surroundings. Remain calm, reassuring, and try to identify what may be triggering the hallucinations. If hallucinations persist after trying to eliminate them, be sure to discuss this with your doctor. Here are a few tips on how to reduce hallucinations. Look around and try to see things through her eyes. What might cause her to misinterpret what she sees? Identify potential triggers such as open curtains, shadows, mirrors, or televisions left on. In the bedroom, use a nightlight to create a more peaceful sleeping environment. Always remember to remain calm and reassuring. Do not yell or scold her. Help her back into bed and reassure her that she is safe.
So what did you all think of the better response, the recommended response? Much better, right?
Yeah.
Yes.
A person with
Okay. So the next behavior we're going to look at is refusing to take medication. So once again, we're going to look at what a common response might look like. Let's see if it,
Grandma hates taking her.
okay. So not working there, so. Medication. Go. Okay.
Grandma hates taking her medicine, even after I tell her what it's for. She asks 10 different times why she's taking it. What should I do? Time to take your medicine, Grandma.
I don't need to take medicine. Who said I have to
take that medicine for what? What are you talking about, Grandma? You have high blood pressure and diabetes. Dr. Brown said if you don't take your medicine, you're going to get sick. And no me feel. Why do we have to do this every day? Just take your pills. I give up.
Okay. So now, what is the behavior that we are seeing? What do you see happening here with the grandmother? Yes.
A little bit of a mini tantrum,
Yes.
refusal to take the meds.
Yes, refusing to take the medication, yes. And what could be causing that behavior, and what might that mean to them, the refusing to take the medication?
The acceptance of not being sick.
Yes,
They don't want, somehow they don't want to feel the independence, you know, the one, they don't want to be sick.
yeah, they don't want to be
Refuse
sick.
it.
Yeah, and especially with somebody with Alzheimer's disease, right? Why might they be refusing that medication, or what other reason why? Yes, sir.
It's also, medication burnout, the tires taking it over and over and over.
That's, yeah, they could have medication burnout. Any other ideas? Anything?
Sometimes it's uncomfortable, those 2 days.
Yeah, yeah. Mhm. Yeah, yeah. So how could you respond differently if you were the granddaughter?
Come with the thing with applesauce and a spoon and say, "Add some applesauce now."
Use applesauce, yeah, put the pill in there, yeah. Sometimes you do have to, put the medication crushed up in something palatable, or, mix it in like a smoothie if they really are refusing and you know that they need this for their health, because if not, they're gonna get even sicker, and, so we know that some medications are crucial for them. So sometimes you do have to put it in something else.
What I do also is, I use time on, use 30 seconds, free to go do whatever you want, and then on top of it, I give my mom blueberries. Rarely happens, but it's like, it's not gonna take too long, and she can process them, she's still in early stage, but also there's a reward system. It's got blueberries.
That's good, yeah, so have like a reward or something at the end, yeah, absolutely. So let's see, so, right, identifying the behavior is that the grandmother, right, is refusing to take the pills, and we're exploring what's causing the behavior. So we see that both of them are frustrated, right? And, she also has forgotten that she has to take their medication, especially those with Alzheimer's, they do forget. They don't remember that they are sick and that they need to take the medication. Sometimes there could even be paranoia involved, thinking that they're being poisoned, and that, the medication is actually gonna harm them. So there's a lot of that going on. I know this did happen with my grandmother, when she was going through this, and she went through a point where she was taking the medication herself, but then she started forgetting, and so then we were helping giving it to her, and then we found that she was actually spitting them out later, holding it in her mouth and then spitting them out. So then at that point we did have to put them in a smoothie so she could take it that way. So it does depend on the individual and kind of what you need to do to help them take that medication that that they need. Yeah.
I might have to do that in the future. Can you mix all the pills and capsules in the same thing?
That's a good question, and that's something that I wouldn't really know if you can mix it all together. I would probably ask your doctor if that would be a safe thing. Yeah.
They get mixed in, you take all at one time, they get mixed in your body, all of it.
Yeah, but for her meds, she can do that.
Yeah.
There's not a order.
Okay. Yeah. I would probably just double check with the doctor and say is it okay to just mix them in?
There's something else, there's capsules.
Oh, the capsules. If it's like a clear, like a plasticky type of capsule that you can, so those you can break. I wouldn't blend.
Good idea, I'll talk to the pharmacist.
Oh, the pharmacist, yeah. Because
That was gonna be my suggestion. truly believe that they're more up on medications and what will and will not mix. And they're
Good
much
point.
more accessible.
Good point. Yeah.
It's not about mixing my meds, it's actually like, if there's pills in them, I'm thinking of putting it in like a bullet or a blender to turn it into powder.
Yeah.
That's what I was thinking of. It's not about, it's gonna be the same pills, it's just how to powder them up.
Oh, I see.
Yeah, because I can't put that in food because you'll still feel the pills.
Yes, yes. You would have to
Talking about
powder
blending
them,
it and powdering
yeah,
it.
blend it up.
Talking about if it's okay to, with capsules versus pills, if there's any,
Mm-hmm.
I mean, how to make it.
With my grandmother, they did just put the medication in the actual blender. It was like a Ninja or NutriBullet, and it did blend it all up, and she seemed to take it fine. Yeah, but it depends, right? Just make sure, you always want to make sure that that's okay to do, et cetera. Oh, yes, yes.
It's a strange one, but there's no cure to dementia, Alzheimer's, okay?
Correct.
And then they might have secondary illnesses.
Right.
That you're taking this medication for. Can that medication be stopped?
Which one?
All the ones that she had before she got the dementia?
That would be a conversation with the doctor for sure. But for example, if an individual has, let's say, high blood pressure and then they get Alzheimer's, the Alzheimer's isn't typically going to take away the high blood pressure, right? So the doctor may recommend that they need to continue the other medication. But again, that would be a conversation with the doctor, absolutely. Yeah. Of course, we see here with the medication scenario is we want to be patient, calm, and maybe show a doctor's note or a fun activity or like a reward, like you were mentioning. In the back, yeah.
I wanted to just say that, depending on the pharmacy and the type of medication, you would compound it into a liquid, which then would be easier to.
A liquid, yeah.
Either give it to them orally or in some form of food, smoothie, whatever.
Mhm.
That just depends on the medication type, so that's how you find it.
Yes, absolutely. So you always ask if there's an alternate for medication, which is actually what the rest of the video is going to discuss as well. But did you want to say something, Sharon? Yeah, so liquid form possibly. Okay, so let's take a look here.
Refusal to take medication is a common manifestation of dementia. It can be very frustrating for the family, particularly as this has to be done every day. Stay calm and be patient, keeping in mind that these medications help your loved one stay healthy.
Time to take your medicine, Grandma.
I don't need to take medicine. Who said I have to take medicine? For what?
Remember, Dr. Brown said you have to take medicine for your blood pressure and your diabetes. He even wrote a note. My patient, Aura Jackson, that's you, needs to take her blood pressure and diabetes medicine every day. So let's take your medicine for Dr. Brown.
Okay, I'll take it today, but maybe not tomorrow. Only because Dr. Brown said it's a good idea.
Okay. Oh, I have an idea. Let's take the dogs outside for a walk. It's a beautiful day.
Do not allow your annoyance or frustration to become part of the problem. Your loved one may pick up on your emotions and become annoyed with herself or you. Here are a few tips on how to improve the situation. Pick a doctor or an individual that she wants to please and tell her that this person advised her to take these medications. If swallowing pills is the issue, check with your pharmacy to see if the medications are available in liquid form. If not, consider crushing pills into applesauce or pudding to make them more palatable. Give pills one at a time with water. Sit next to your loved one when you try to offer the medications instead of over her. If she continues to refuse, allow her to calm down for several minutes and try again. Remember to be patient, as this process may take several attempts. In regards to specific medications, prioritize the most important medications to be taken first.
Okay. So yeah, so good tip at the end there is prioritizing the more important ones first. If you know that the medication, administering medication is going to be a struggle. So in summary here, when you're looking at a behavior or they're exhibiting something, right, you want to identify the behavior that they're showing, right? Be specific of what they're doing. Then 2, explore the cause and the meaning behind the behavior, right? What are they trying to communicate? And again, thinking about the potential triggers, a health trigger, activity trigger, environmental, or a communication trigger. And then 3, adjust. What can you do to adjust your approach, change the way that you're going to communicate to them? So, and even think ahead, right? If there are certain behaviors that really happen on a regular basis, then plan ahead and kind of write something out of how might you approach that or respond to those behaviors the next time that they occur, just to be prepared. And when you are overwhelmed, take a deep breath. So everyone inhale with me and exhale. And, I forgot, okay, so after the breath, we can calmly discuss care ecosystem. So this is a program that we are offering here. You can contact that email at the bottom or phone number. And if you are caring for someone with Alzheimer's or dementia, and the person you're caring for has Medi-Cal and they're in Los Angeles County and lives at home, then you may be available to participate in our care ecosystem program. So this is a personalized care plan that supports your loved one with dementia to help them stay at home as long as possible and to reduce hospitalizations. So it's, again, if you want more information, you can email ecm@alzla.org or call the 323-930-6289. Okay? And our information here on the screen, as well as we have some collateral and handouts here. But I do want to, we have time, I do want to open it up for any other questions. I wanted to make sure to save some time for questions. Oopsies. Yes, yeah.
This program that you're talking about, the control system, they all come to you or you have to go to them? Or they give you advice? What does it entail?
So that's a good question. If they come to I know that they do over the phone, right? They can do things over the phone. I'm not certain how the rest of it would be done if they come to your home. Or you would go, I think it was either everything's done over the phone or they come to your home. That's why the contact is there to email for more information. Yes, they can help you find resources, yeah, it's a good care plan to, again, help your loved one try to stay at home for as long as possible and reduce the amount of times they go to like the emergency room and things like that. So I'll leave it there. Any other questions? Anything else? Yeah?
Going back to the hallucinations.
Hallucination.
At what point might medication be appropriate?
At one point, might a medication be appropriate for someone with hallucinations? That, again, is a conversation with the doctor. If they think that something, if they think it needs to be treated, right? Especially if it's maybe really disrupting the individual and the family member sees that it's starting to be a big concern, maybe safety issues, maybe that might be a reason to address it with medication. But again, that would be definitely the doctor would decide.
I have one question, and I'd like to open it, because I'm new to this. how can you differentiate, when, for example, my mother's behavior, there's certain patterns of behavior that she already had. But I noticed it's more, it's intense now, like an argument or something, she's more intense. And I see bits of her old personality, but new added stuff. How can you differentiate if that's the Alzheimer's or her personality? Is there a threshold or some sort of segue into that? So I'm a little confused because I saw that twice already in my mom. And maybe you guys have more experience in that, but that's kind of like what's puzzling me now, to be able to know,
Yeah.
is this her
Her old-
personality from old, or is it the dementia?
Yeah, I would love to open it up if anyone has a similar experience. Has anyone had a similar experience?
That's a good question, because I'm kind of like in a limbo right now. Does anybody have any?
Well, with my sister had Alzheimer's, and some of the things were changes in behavior.
Right.
That's what I always look for, with the changes in behavior. And some of those were behaviors that were typical to her, but became intense.
So intensified, when it becomes more intense. Okay, that's what I kind of felt, but like I said, I'm new to this, I'm not
Yeah.
sure.
Yeah.
Thank you.
I have one thing to add. I think that's an excellent question. And I always try to err on the side of giving the benefit of the doubt,
Okay.
because it makes you feel more empathetic and less frustrated as a caregiver.
So in what sense, give me an example.
So if you're seeing behavior that this person is in their 70s, 80s, 60s, and you haven't seen this behavior prior to that, in the 50 to 60 years prior, chances are statistically the behavioral change is a result of the disease process, right? So given that it's more statistically likely if it's new behavior to be an unfortunate part of the disease rather than their personality, I just remind myself I'm frustrated with the disease, I'm not frustrated with the person.
Yeah.
Because
Yes.
you don't want to dismiss your own frustration. Your own frustration is valid, it's where you direct it and how you contextualize it.
Yeah, thank you. Yes.
Great question.
Yeah.
Yeah,
And that was a great explanation, Bree. Thank you. Yeah.
The other piece of that is that Alzheimer's is a differential diagnosis, and it brought up in the video, saying make sure that there aren't other things contributing to the behavior, like changes in vision or changes in hearing,
all that.
cause frustration and anger, and figuring out too if these behavioral changes.
Well, she's got all that too,
Yeah.
so I know that's contributing to something. It's just, I noticed there's a little bit of her personality there, but I think the key word was intensification, you intensify. And I'm going, okay,
Yeah.
well, she's drifting from what she really is more into the illness. And what you said, I don't wanna get frustrated because I don't wanna be that girl on the daughter
Yeah.
in the video.
Yeah.
So acknowledging my own frustration too.
Yeah, absolutely.
Yeah.
Thank you.
Jamie, that's a brilliant caveat. It's really helpful data and information for doctors, nurse practitioners, and clinicians who you're meeting with. So if you're noticing changes in behavior, journal that, log it. What does the behavior look like? Is there something that happens before, something that happens after? And this is all information you can bring to the clinicians to help
Absolutely.
track the progress that they're making.
And to add on what Bree is saying too, because it is important to establish like a baseline for them to know, okay, what is their like typical behavior like at the start of all of this, right? And then how is it changing as the years go on, as the disease progresses? So that's, the journaling is a good way to see what changes and new behaviors are occurring.
And this is my sister had Down syndrome.
Okay.
So they couldn't use standard testing.
Right.
And what they developed is a checklist of these are the behaviors that the person performs and how do they perform this. So, it would be themselves. And then you start to see, well, they need some assistance with this, they might need assistance with showering, assistance with and you record that. And even though it's to me, even though it's set up to help with people who have disabilities, I think it's great to be able to just document what's
Yes.
going on with the person. And if I could think of the name of it, I would tell you. I just put it up online.
ADLs, activities of daily living?
No, but that's what it covers.
Mm.
It's the early dementia screening.
Okay,
I think.
I'll look.
The dementia screening.
You can go to NTG and look up early
Okay.
screening.
And I saw your hand, yes?
Well, my granddaughter reminded me, you cannot reason with Alzheimer's.
Right.
Like you can. And so, like you said, you have to say, okay, I know you're worried about this. And I get it. But we're going to do this now, or please try to stop worrying, we'll be okay.
Mm-hmm.
My husband he worked so hard on his life, had everything all set up for us. Well, that behavior continues, even though he's been retired almost 18 years.
Mm-hmm.
He's still worried about are we provided for, do we have what we need? And I guess because he doesn't go to work now, that is so intense in him. He's just sure we're gonna lose the house, you know, they're gonna come take everything away. And it is a lot to deal with at times. And all I can do is try to reassure him that he did a good job. He did a really, really good job, and we just have to continue to do it. Let's just go and do what we always do. And if something bad happens, then we'll take care of it. Because he's so sure that disasters are
Is what I'm
Mm-hmm.
and there's no way that I have found yet
Yeah.
to convince him of it.
Mm. Thank you for sharing that, though. I'm sorry you're going through that. Okay, I see we're just over time, but be here if anyone has any other questions. Next month, we're gonna be doing communication and dementia, so I invite you all to come back. Today, focus on behavior, so more on like, what do you do? And then next month is more on what do you say? So we're gonna be talking about how might you communicate or what might you say in certain situations. So hope you all come back. Yes?
Just one more thing. One of the things that helped me the most was remembering that my sister was lost. And she was, and they say that she's not acting out, she's not trying to be difficult, she's lost. And I had to keep reminding myself, she's lost.
Yeah.
And the reason for her is to kind of try to help people.
Thanks, Sharon. You always had great insight. Thank you. Appreciate it. Yeah, thank you all. Okay. And thanks everybody online. Stop share. Yes, can I give you a hug? I know, I was like, oh my gosh, I know her. Where have I seen you? Oh, but now in person, not behind the screen. Oh, thanks for being here. Hope we're able to come next month too. So, yeah, I know. I think, do we have flyers of the series over there? I meant to print some out. I forgot. Thanks, bye, Sharon.